Jessica Viker, what's up? How are you?
Viker.
See, I always ask ahead of time how to pronounce names that I think I don't know how to say. And so I'm like, it's Viker, because of course it's Viker. And of
Yeah,
course
the
it's not
Norwegians.
Viker, it's like
Yeah.
Beaker, rhymes with beaker.
Correct. Which, was definitely a high school torture device in science class, but yes.
But you aren't, yeah, exactly. Beaker the beaker.
Yep.
Right? Something like that.
Yeah.
I mean, it's just wonderful to have people like you out there. Guys, she is keto_nurse_Jess. And Jess is spelled with 2 S's. She is a nurse, certified health and wellness coach, and likes to help people optimize their health with the proper human diet, which that is Dr. Barry code word for keto. So you in here today. And so you went to nursing school how long ago?
I sat for my boards. I graduated in 2012. I sat for my boards in February 2013.
Okay, so about 7 years you've been an active nurse. You work in a hospital with a...
I do. I work in a really very big, busy trauma center, but I decamped to labor and delivery 4 years ago, and that's part of my story, actually.
Well, let's hear your story. Tell us how you got interested in wanting to be a nurse, and then how it all came around to understanding nutrition, because most of the medical professionals I've had on my show, they don't know anything about nutrition before they started learning on their own. You didn't get it in formal education. So tell us that whole story.
I actually, when I was in college the first time, I tried Atkins, and my mom had tried it first, and we both had struggled with our weight on and off. And now that I know what I know about my body, it makes total sense. And it took very little to lose weight on Atkins. I was 20 years old, but I was like, oh, well, this seems like a fad diet, but it works. And many years later, I was actually working as a paralegal. I'm a certified paralegal in the state of California. I was going to go to law school. I decided I hated helping people argue. It just took my soul away. So I was like, oh, I can't go to law school. I got in and didn't go. My dad wanted to throttle me. He was so disappointed. He goes, what are you going to do?
Take my soul away perfectly describes what happens online on the internet every day with social media sometimes.
100% times 1,000. You can't go home and get away from it now.
Yeah.
So basically, I was kind of soul searching, and my mom had been a nurse. My mom's actually a nurse epidemiologist, an infection preventionist, and did one of the first studies on the communicability of HIV at UCLA in 1984. I've been around medicine my entire life. I had almost no interest in going into it myself. But I'm kind of a science nerd. And I started reading midwifery books and thought, oh, it sounds so cool to bring life into the world. That is the antithesis of helping people fight. That's what I'm going to do. So when I was 30, I had just gotten out of a really, really bad relationship and broken off with him and come home to LA with nothing set up in my life. I knew I wanted to go to nursing school. All of my the places that I had applied to were in Northern California, not here in LA. So I jumped into an accelerated Bachelor's of Science program and just dove in. My goal to go into labor and delivery shifted pretty rapidly because I started scoring really high in critical care. And there's this inherent bias in medicine in general against obstetrics as like not real nursing, which no. I've been on both sides of the aisle. I can say a no, but I was getting talked out of it.
Why did they an obstetrician field is invalid? Is it like the chiropractor is kind of quack medicine?
It's not the quack side. I think they think it's easy. And I think because it's a natural process, people assume that you're not dealing with comorbidities that, I mean, I have patients that are equal, if not sicker, to some of my ICU and step down patients I've had in my career. So I can fully debunk that myth. So my advisors were like, "You're so gifted in critical care. Go into it."
It's so people judge even I was a poli-sci major. Oh, you're out. I'm like, do you know American history and how the system works? No, people do. So I did double major as well in English. So I do have, nobody faults you being an English major.
I was an English major. My first degree, I was an English major with a psych minor at UCLA.
Why? This is why you and I get along so well. I knew there was something about you, Jess.
We got some similarities popping off. So yeah, anyway, they tried to talk me out of it. And they did successfully. And when I graduated, I went into a really, really busy, kind of crazy cardiac telemetry unit at a major LA trauma center. After about a year, I got cross-trained for step-down ICU after cardiac procedures, people that had come off open heart within 24 hours, people that had come from cath lab. You had to get cross-trained in ICU for that. So that was like a very cool honor after my first year of nursing to go through that. And I enjoyed that tremendously.
Yeah.
But in my own health journey, I was starting to feel really sick. And I was probably 34 and I had no energy ever. Was super just couldn't lose weight, couldn't get any energy. I think my mood was really down. I was super depressed about my job. It was so stressful. I had few resources in that job. And I started to sort of think back on that whole low carb thing. And my mom had been low carb for several years. And she's like, you should probably go back to that. I'm like, yeah. So a friend said, hey, try Whole30. And
which is an elimination diet. For those of you that don't know, that's an elimination diet where you pretty much every cross-reactivity food you can think of, including eggs and nightshades and the whole shabam.
Yeah, I mean, you only eliminate eggs if you think you might have a problem with eggs.
Right. I think
on eggs.
Melissa Urban, who wrote the book, you at least cut them all out to start, and then maybe add back in eggs first, and there's no reactivity, then you keep them in your diet.
So we did that. Jason and I did that. And it went really well for me, but nothing changed. I didn't feel better.
Jason's your husband, is that right?
That's my boyfriend.
Okay. So you threw in there, and people don't know who Jason is. I don't know if Jason Fung went on this diet with you. I didn't know who Jason.
And I are homies. No, that's how rumors get started. No, my partner Jason and I decided to try it, and he did it just to be a good sport, just to kind of support me. Yeah. And I didn't feel better, and I had made some friends in the forums there, and I was talking to one particular friend, Janelle. I hope she's watching. I miss her. She's a nurse too in Indiana. Hi, Janelle. And she said, I think your carbs might be too high. I said, but I'm following it to the letter. And, I'm not eating anything I shouldn't eat. And she said, have you heard of keto? And I said, no, what's that? And she said, hey, listen, I want you to get this book. It's called Keto Clarity by this guy, Jimmy Moore. I want you to read it and then circle back and we're going to talk about it because I think that's your problem. And so I bought your book. I read it in like one night. Yep. and did two things. First, I called my mom and I said, oh, we're doing it wrong. And then I called Janelle and I said, okay, yeah, I'm going to try this, but it scares me because it goes against everything that I know, right? Yeah. So I tried it and I still wasn't feeling well. And that's part of my journey because I turned out to have huge thyroid issues. I have reverse T3 hypothyroidism, which was so hard to get diagnosed because no one tests reverse T3 or knows what it is.
Don't run that. They don't run thyroid antibodies. Like all things that would show disease, like TSH, T4, and T3 are the standard they usually run. But run the whole damn panel. Why wouldn't you do that?
And TSH just says your pituitary is working. I mean, very rarely is the etiology of the disease coming from the pituitary gland. So at that point in my journey, though, I had no idea what was going on with me. Still didn't feel good. Kind of stumbled through it for a few years. And my mom this time called me and said, hey, I got a book you got to read. My mom has Hashis. And she read Elle Russ's book, The Paleothyroid Solution. I read Elle's book in a night and went, oh, crap, I know what's wrong with me. And my internal medicine doctor at the time honestly laughed at me, but not in a mean way. He was just like, no, you're fine. Your TSH is fine. Your T3 is fine. It's something else. You're just tired. You're a nurse. I'm like, no, that's not it. So I got my OBGYN to, sorry, something just happened with screen share. My OBGYN agreed to run reverse T3, but told me ahead of time, I will not be treating this. I'm not interpreting it. I'm doing it as a favor.
They don't know how. That's the
Right.
thing.
Right.
We're going to get into this when we start talking. I'm loving your story, by the way. But like a lot of mainstream medicine, they don't run fasting insulin. They don't run HSCRP.
No
They
clue.
don't reverse T3 because they don't know what the hell to do with it.
Yeah, it's not taught. It's such a useful tool. It's not taught. All those inflammatory markers aren't taught, and they're so useful. So yeah, I read Elle's book. I said, I got a problem. Tried to get help through traditional routes, got my reverse T3 back. I was on night shift at the time, which is what I think shot me over the edge as far as my health. And my reverse T3 was ridiculous. It was like 30 or something. And it is supposed to be under 20. I mean, they used to do that's kind of a hard question to answer because they used to do ratio and they got away from ratio, and now it's kind of like,
what's the optimal? What is someone trying to optimize that? What's
how
that?
you feel. It's really how you feel.
Oh, how you feel.
I mean, really, someone who's properly managing a thyroid is taking into account how you're feeling and not treating the numbers as much. So I ended up having to find a naturopathic doctor that would treat my thyroid. And we've been on this for almost 3 years, and I am finally where I need to be and feeling like a person and losing weight. I couldn't lose weight on keto until my thyroid.
Are you on Natrathroid or that?
So with my particular issue, we tried T4 and T3, not the Natrathroid, sorry. And what got me optimized is after a couple of years, we realized the T4 was screwing me up. And this is where I start getting nerded out on metabolism and prohormones, is that the problem with me is so unique even among reverse T3 problems that it's not a T4 to T3 conversion issue. Your usable thyroid hormones T3, your pituitary tells your thyroid to make T4. Using iodine and other factors, your body converts it to T3, which is what your body uses for your metabolic energy, basically. I don't convert. You throw T4 at me, I just turn it into reverse T3, which is garbage, essentially. It's a waste product.
Is that genetic, Jess, or that's some just abnormality in your metabolism?
We don't know at all. There's a few tests that are kind of pricey that can look for like protein stuff. And I've been considering it lately just because it's interesting to me.
But what would, like, if you found out it was this, whatever this is, what would you do differently than what you're doing now?
Nothing. We came upon it just by empirical, just doing. I mean, that's the thing in medicine. We have to ask ourselves all the time, like, would this change the plan of care?
Well, and it'd be interesting too. It's like, you should get a researcher to do a case study on you and they'd pay for it.
I'd love to be the researcher, to be honest with you.
If you're that unique in medical research, they love the anomalies. So you would be interesting. You should reach out to UCLA and see if they'd be willing to pay for that.
I don't even know, Jimmy, I may not be that unique. I think that we just don't know. I think it's just not looked at.
That's even more intriguing. Like, what we know is far in excess of what we think we know, even about things like ketogenic diets. What we think we know, especially as it relates to like chronic diseases like cancer and Alzheimer's and all the rest, what we think we know, we don't even know on the map of what we actually could know.
Yeah. And you have to know what you don't know, or you get into dangerous territory. So,
or at least acknowledge what you don't know. Like,
yes, it's more precise. Yes.
I did a post about keto. People stop saying keto is the answer for cancer because we don't know that yet. Some cancers, yes, they have a glucose feeding mechanism, but there's some cancers that may feed on a mix of things. And so we can't just say carte blanche, oh yeah, go keto and you'll never get cancer, or go keto. That's the wrong message. And so we can't step ahead of the science.
Well, and diet is always only just adjunct therapy. Like, that's what's important to remember, and that's actually part of my coaching as a coach, is that medicine's important. It's not always correct. It's not always like on the cusp of where it needs to be and moving forward, because it's a slow process, but it's adjunct. It's in conjunction with, always. You can't live and die by what you're putting in your mouth, but it still can kill you.
Yeah, we see chronic disease every day, and we see it with this COVID-19 this year. All of those people that have the comorbidities because of their poor nutrition and lifestyle choices, it caught up to them.
Yeah. Yeah, it's definitely a huge factor. And it's really sad
Oh,
because I used to wonder, I used to see like 42-year-old women with the first stroke. And I'd be like, how the heck did this happen? She's not really obese. Okay, well, she had high blood pressure. She's insulin resistant. She's on metformin because she's pre-diabetic. And as a young nurse, it didn't connect. Actually, when I went to OB and started delivering these people in their teens, 20s, and 30s, and seeing what they were already dealing with at that age, and looking at preeclampsia and gestational diabetes and how those things are diseases of pregnancy, but don't necessarily completely go away when you deliver, have sequelae, they have fallout. And it was like, oh, it just coalesced. The big picture was like, okay, this is how we got here. It was a mystery until I saw them younger and went, oh, okay.
And then when you follow those kids that are born of those patients, you see that they develop some of the same things. And people, I see that's a case of genetics. I'm like, no, it's not necessarily just genetics. Yeah, that's an element of it. But like my mom was over 300 pounds when she had me.
Yeah.
No, I had a predisposition for insulin resistance. And so you're seeing metabolic disease in these women that are about to give birth. And then that little baby is already destined by not genetics, by the behaviors and everything of their mother right before they were born.
And microbiome and breastfeeding versus formula feeding. Not that I'm shaming formula feeding, but it is a factor. That's another thing. People want to black and white put things into categories in life. That is what we do. That's our problem in society right now. Things in medicine, especially chronic disease, are what we call multifactorial. And they're not just one thing.
Right.
And you can't blame it on one thing. And we get here through, things diverging together. All these little roads come together and you end up being that 42-year-old with your first stroke.
Right. But people like prescription, not necessarily drugs, but just they need a plan. And so we start talking about something like bio-individuality, and that we have to find an individualized plan, which I know is what you do for your patients. Right. Yeah. That's what you do. And so it's like, people don't like that. They kind of want to be told. It's why we've had dietary guidelines that have been very monolithic, and why they failed so freaking miserably, because people wanted that prescriptive nature, but it only applied to maybe 20% of the population, and the rest of the population is going, I don't know why I can't lose weight and get healthy, and doing everything right.
Yeah, they're set up to fail. And it all came from anxiety over President Eisenhower's heart attack is kind of where it all started.
1904.
Yep. And people wanted answers. They wanted to prevent it. They saw someone powerful that they respected have this health issue, and suddenly it became almost, I don't want to say hysteria, but it was like the focus of people's health journey. And then Ansel Keith came in with his dumb, stupid, crappy study that wasn't a study, and the rest is history.
I said, tell me how you really feel. Dumb, stupid, crappy. I've never heard people call it dumb, stupid,
wonder crappy. How I really feel.
Oh, we'll answer you. Just say how you really feel. Just kidding.
No one will ever wonder. That's not
exactly.
Exactly. Yeah. I mean, I was raised by an epidemiologist. I read a bad study and I get angry.
Well, a lot of the studies that are cited by the vegans as to why you need to eliminate meat, it's almost exclusively epidemiology, which even you said your mom was the epidemiologist?
Yeah.
Yeah, so even she would say, well, you can't just rely on epidemiology. You need randomized controlled trials.
I mean, that's part of epidemiology. I mean, epidemiology is simply the study, like the statistical study of incidence.
Right.
You need the study of infectious disease or the study of metabolic disease or the again, adjunct, multifactorial. You need to look at it through the lens of other things. I mean, epidemiology is really just the numbers. There's
Brunch.
a whole other part of the pie.
Right.
But yeah, those studies, it's all confirmation bias, and you know, n equals 1. We are our own experiment, and it does frustrate people. I have a client right now, I love her to death, but when I'm like, we're going to have to test this on you. She wants something prescriptive, even though she's going this route. She wants to know exactly how much fat she should have. I said, no, we're not counting fat. She wants to know exact, and she is also, you know, a nurse and a researcher.
You know why? Because we have been conditioned that diets are what work to help you lose weight. That's what we've been conditioned. So when you break people free of that diet mentality and you kind of give them more of intuitiveness, listening to satiety, listening to how you feel, you know, paying attention to all the things that we never paid attention to because we were so focused on looking at the prescriptiveness that we missed all those clues.
And time. You have to give it time. I mean, I've been on this journey probably 5 years total, and I'm only really getting to my best health now. I mean, it took time, and yeah, it was frustrating at points. And I too like wanted, just give me the answer. Took me down some bad paths, you know, just wanting the answer. But you know, you have to try it. You have to be willing to experiment on yourself.
Well, and when you redefine goals, I think a lot of people, when they start on a nutritional health plan, the goal is weight loss. That's kind of their thing, unless they have some chronic disease they're trying to treat, like you did with thyroid stuff. It's like you make that your goal. And so when you quote, don't lose weight or don't lose enough weight, you think you failed, even though dramatic metabolic changes are happening on the inside. You're more energetic. You've got mental acuity. You've got all the things. But you kind of dismiss all of those because your stated goal and purpose was to lose weight, and it's not happening at the rate that you expected.
Or the inverse, you're losing weight, but you're not healthy. You know, that's another problem that I've seen before.
I would push back on that one. There would be people that would love to lose weight and not give two rats you know what about their health.
I don't disagree with that, but I'm saying for me as a coach, the problem when I do ask people, when they ask me what's the best route for them, it depends on what your goals are, is probably something I say like 9 times a day. It depends on what your goals are. How much, you know, fat should I be adding to my meals? It depends on what your goals are. You know, how long is this going to take? It depends on what your goals are. What are your goals? You know, and what your body's going to do, and how we'll change tack. You have to be willing to change tack as you get new information, as you get new data, as you learn more things about how your body reacts. You have to be willing to like, okay, we're changing course. Let's move the sail over. And I was going to say, and people just want it quicker than that. And that's part of the problem.
So just tell me how someone loses weight. This will be fascinating for people to hear. How does someone lose weight, but then their health doesn't get better?
So traditional diets are basically calorie restriction. And I'm not a huge calories in, calories out person. I think that ketogenic protocols are a huge proof that that is not a hard science. I probably eat more calories now than I ever did, and I weigh 40, 50 pounds less than I did a year ago. When you are restricting calories and you are a carb burner and not a fat burner, and your body needs glucose in order to basically run all the operations of your cells and tissues, if you restrict that, your body is going to be like, I need energy. I need to run the business here. And it will start going to fat cells and lysing, which is kind of just killing and exploding, fat cells to get the energy from there. And that is why you lose weight.
And muscle.
And muscle. Yeah. Oh, yeah. Yeah. And it doesn't mean that your electrolytes are optimized. It doesn't mean that your muscle mass is optimized. It doesn't mean your hormones are balanced. That's the biggest thing I see with people that have done calorie restriction, especially women. I'm not even talking menopausal. I'm talking like menstruating young women. The amount of estrogen dominance is crazy. And the link between estrogen dominance and insulin resistance is really high too. And you see PCOS, so many women have PCOS when I don't think 50 years ago, 60 years ago, we had these numbers. It's such a disease of our time. And it's pre-metabolic syndrome, basically. It's one step down that road we talked about in young life that is predictive of your health down the line.
Yeah.
And it's a good marker, unfortunately. It's a very predictive marker.
So that's with a standard typical calorie restrictive low fat model of trying to lose weight and get healthy. So you definitely can lose weight and not be healthy. What
Right.
about those people who eat like dirty keto or some other form of trying to like do a workaround of the ketogenic diet, which I know people, and please don't scream at me, people. I know you've done well with the job. It's better than the crap you were eating before, but talk about the long-term ramifications of you lost weight, but what else is happening metabolically?
Yeah. So it comes back to that whole like depends on your goals thing. And if you are, like I was when I was 20, actually, this is a great example. I thought I was very low carb and I would go to work. I was working at the Gap in college and there was a little smoothie place next to the store and I would get a protein shake every morning. And now in retrospect, that was probably 60 to 80 grams of carbs I was downing in like one liquid meal. But it didn't affect, I still lost weight because I wasn't as metabolically damaged. So there's two things with that dirty keto. If it works for you right now, you're not going to be dissuaded from doing it because if your result is weight loss and your goal is weight loss. But if you're a symptomatic rheumatoid arthritis sufferer and you're doing this protocol to reduce inflammation, to reduce flares, to improve your joint health overall, you're just shooting yourself in the foot. Cutting down your carbs isn't the only thing. Processed food has a ton of inflammatory things in it that are not going to help your goals at all. And so, yeah, if you're 20 and you're not metabolically sick and you want to do the cut the carb tortillas and all of that stuff, you know what? More power to you. I don't know what the effects of that will be long term on you. I have some suspicions that it's not metabolically that good.
Well, and I just recently read a study on my Jimmy Ranch show about the rate at which you eat your food determines whether you have a glycemic response that's higher or lower. And the slower you eat your food, Mama always said to do that, the more that you can digest it and the more stabilized your blood sugar would be. Whereas the long was 20 minutes in the study. 10 minutes was the fast. And so they had them eat it. And guess what? It was 20-year-old women in Japan. And they had, I was looking at the meals, I mean, hundreds upon hundreds of carbohydrates in a day, mostly from the rice and some of the other kind of cultural foods. And they showed their blood sugar, Jess. I was like, oh my God, it was like 256, 2 hours postprandial.
What? Oh my gosh.
That's going to end up being a problem down the road.
Oh God, yes. My gosh. Yeah. And it's also when I see these keto shakes and stuff, I have concerns because again, speed of what you're getting in your body. If it fits your macros, is a pet peeve of mine because again, it's a hack. It doesn't work. At least not for people like me that have real health inflammatory issues I'm trying to correct. So if you're drinking your 10 grams of carbs and you're like, it's half my carbs for the day, it's fine. It's just my protein shake, it's my pre-workout. It's like, that's all hitting your blood sugar at the same time. And a carb is a carb is a carb is a carb, people. I hate to tell you this, I hate to be the bearer of bad news. There is no difference in your liver telling your pancreas, hey, we got a problem here. You need to respond. You're still going to have a glycemic response to any carbohydrate, any. And then the cephalic insulin response, if you taste sweet, there's studies coming out saying that even stuff like Swerve, which rocks, that sucks, can raise your blood sugar. But again, test it. Don't take my word for it.
Can is the key here. When people hear like yourself say things like that, they're like, oh my gosh, I got to avoid Swerve.
No, test it.
That just said test it. Why do you think there's such reticence to taking like a little ketone meter or blood sugar finger? Why are people so trusting to listening to an influencer like me and it happened to Jimmy, so therefore it's going to happen to me? And I always say, this has happened to me. Now you test it.
Test it. Absolutely. Because no, we're not the same. This bio-individuality thing is absolutely real. I mean, I see it in every aspect of my career, whether it's bedside or coaching. We are also individual. What works for my mom doesn't work for me. My mom is strict carnivore and is happy as a pig in you know what. I can't be strict carnivore. I get energy issues. And I've tried it. Ken Berry told me to try it. He said, look, that might be the one thing that you're autoimmune, because I have some weird inflammatory stuff they can't quite put a name on. And he's like, try it. And I couldn't hang. I tried it for about a month and I didn't feel better.
And meanwhile, I had 2 ribeyes for breakfast today. So it's like what works for one doesn't work for another.
Right. And I'm like probably 15 grams total or under a day. I'm very low carb, but I'm not strict carnivore.
Why are people so reticent to doing their own testing? Is it just laziness?
You know, I think our society isn't super set up for that idea. We have so much quick information and we have these devices in our hands where we can at any second go, how many grams of carb should I have in a day? And especially these younger kids, I mean, I'm 40, I'm not a kid. I remember no internet. So I remember going to the library and having to research something. It took effort. And now it's beautiful because we have all this information and that's super cool. But at the same time, not all good information.
The Dewey Decimal System. You can actually mess with kids today. You can mess with kids' heads today if you say, yeah, tell me what the Dewey Decimal System is. And
it's the worst thing ever. Don't miss that.
Yeah, Britannica, that would be another.
Oh, parents had the whole, I had, write a report. So Saturday morning, you'd go find the number.
Yes. Smelled us because they didn't get open, but like twice a year when we had reports to write.
Yeah, and then your hand would cramp from handwriting your book reports and your term papers. Right. I remember those days.
Jess, we are showing our age badly now, but
okay. Well, no, we've got keto on our side. We probably have some longer telomeres. We have some epigenetics working for us. So I'll take the wisdom.
And if I can, I will live to 110. I'm doing all the things.
109's always been my thing, Jimmy. And ask anyone, I always say I want to be 109. My grandmother's 93. She is a hysterical example of all of this societal change when it is in the dietary realm. So my grandmother's 93. She was born to Armenian immigrant parents in LA. They were completely working class poor. In their backyard, they had a cow, they had chickens, they made all of their own cheese, all of their own yogurt. Everything was live cultures. Everything was completely preservative free. They were poor as dirt, but they were very healthy because what they were eating was a proper human diet. This is how she was raised. She looks at me eating keto and she has a panic attack every time I bring it up. My mom as well, because to her, it's a diet. It's extreme. And I said, Nanny, how in the heck is this any different than how you were raised? And this was like 2 weeks ago. She was like, oh, well, I guess it's not. But she still isn't like, yay, keto,
But you can appreciate her desire to not have a label on it because she just ate that way. She didn't care low carb. It was naturally low carb what she ate. She didn't care that it had, healthy cultures in it. It was natural probiotics. She didn't care about that. She knew the food tasted good and it fed her family and they felt great.
Yep. Fresh meat, lots of lamb, lots of beef, lots of eggs.
There's a lesson there, Jess.
Oh, yeah, there is.
Away from labeling, keto, carnivore, perfect human diet. Should we just say how you eat? Like it's almost as if how you eat, the default in our culture is, oh, you eat low fat and you eat lots of green. That's the default. But how you eat can have a whole nother meaning if you just eat what makes you feel good and makes you healthy.
Right. And again, there's no one size fits all. And when I start coaching people and they say they want to go keto, again, I hate labels. And that's why I really like Ken Berry's Proper Human Diet little code, because it kind of takes, I mean, it's a little sanctimonious. I feel kind of like a douche when I say it, like it's a proper human diet, but he's correct. It is. It's what we're meant to eat. So I think that labels don't help in the sense that people have a visceral reaction when you say keto or vegan. Like I hear vegan and I go, ugh. But I think that if we could normalize keto and carnivore and low carb protocols as how you eat and not have to label them something, I think that would be the healthiest thing we could do.
Can I tell you, I've been at this since 2005 when I was on the Atkins diet, 2004 when I was on the Atkins diet, 2005 I started blogging, 2006 I started podcasting. So I'm the old guy in the community. And I remember way back then, it was such a like foreign concept to even talk about carbohydrate restriction, even a little in our culture. Definitely not high fat. Everybody was describing Atkins as that high protein diet. They didn't really mess with the fat. Well, then in the early 2010s, paleo comes along and they start talking about eating healthy fats. It wasn't really a low carb diet, but it was healthy fats were encouraged. So then they shifted away from high protein, then looking at high fat. And then like keto came along and, oh crap, what do we do now? So we've seen this evolution just in my career in the nutritional space of how now people generally recognize cutting carbs, at least sugar and other kind of culprit carbs, ultra processed food carbs, they kind of generally know that's not a great idea for your health anymore. Whereas 15 years ago, it was a total, like nobody believed that.
Except diabetic educators are still telling their patients they need carbohydrates.
Oh, and in the mid-19, I mean, I have just been frustrated by dietitians in the midst of COVID-19. Oh, we know you're stressed, honey, so go ahead and eat all them processed carbs. It's okay. The Doritos.
Are people really saying that? Oh,
you have heard this. Yeah, they were encouraging people. This was back in March, April, encouraging people. You know, it's stressful in life right now, so just eat all the carbs. We'll work on it after this passes. And of course, we're now 7 months in, and we're just as stressed as we ever have been.
Acutely raise your blood sugar that much, and you're over your baseline. You are making yourself more susceptible to viral proliferation. Even though viruses don't eat sugar, they're not really technically alive.
And that was
that's crazy,
because the carbs were raising inflammation. And the first thing you want to not have when a cytokine storm of inflammation comes in your body is existing inflammation.
I went super strict. I mean, I'm pretty clean. I don't really mess around too much, but when we started seeing patients in the hospital and I knew that I was in a position where I was taking care of folks and I had a higher likelihood of being exposed, I really cut my carbs down. I got real serious about it. And like anything else, it falls to the wayside. I'm pretty much back to what I would normally do right now. But those first month or so, I wouldn't even pretty much eat a vegetable. I was so paranoid about inflammation. And came back to
added supplements as an adjunct. I've been taking probably 25,000 IU of vitamin D. That was first thing I started doing. I generally take about 10. During the summer, I backed off a little bit, got sunshine, but I've been very high dose vitamin D to try to be a prophylactic for this thing.
Right. The problem with COVID-19 is obviously we don't have any long-term studies to follow any of this. So where the science makes sense at why it would be effective and it can't hurt, my God, it's vitamin D. We're all deficient anyway. We can't say that it helps, but it certainly won't hurt. Zinc, vitamin D. I've heard studies about melatonin, and vitamin C as well.
And I've been doing
vitamin C. Actually, there's a product when we have a patient that's actively ill with COVID, not just swabbing positive, but having symptoms. They tend to put them on a little regimen of stuff, including vitamin C, vitamin D. I'm trying to think of what else. Some of it's not great for pregnancy, so we don't do it. But it can't hurt. None of that stuff is harmful. It's not an experimental drug. It's not an off-label use for a drug, which can be a lifesaver, as we know in certain situations, like off-label for Viagra is a cardiac drug for babies. So it can be helpful. But what, Jimmy?
irony that an off-label Viagra is heart medicine for babies.
Yeah,
Irony.
it's interesting. Actually, Viagra was discovered second.
Right.
It was already a heart medicine for babies. I don't want to know how they figured that out. But yeah, I mean, it's not harmful. These things aren't harmful. Do it. I mean, my partner Jason, he's not a doctor person. He's not a health nut, but he does take his zinc and his vitamin D and his vitamin C every day. And I've seen him make that change.
I also include CBD oil, which has been in my regimen for a little while. I've been upping the dose of that as well, again, as an anti-inflammatory.
Yeah.
I recently added ashwagandha to help with some of the stress, adaptogen for those of you that don't know. So yeah, I mean, you do all the things to take care of yourself. Why aren't we hearing like all of this kind of thing from on high of the people kind of helping us with this virus? It seems very elementary that you could say some of these things that could be a preventative, or at least like you said, at worst case, it's not going to hurt you kind of thing. Even Dr. Fauci recently came out and says that he takes both C and D on a daily basis in the midst of this COVID-19 crisis. And yet all we hear is wash your hands, socially distance, put on a mask, all the things. Like, why aren't we hearing real things that can actually help people improve their immunity?
Well, washing your hands, wearing a mask, and socially distancing are real things that do improve your ability to stay well. But as far as actual humoral immunity inside your body, no, I haven't. Again, like I said, I think it's rather new. And in medicine in general, unless something has really, really been found, sometimes it's obsolete by the time it becomes an accepted treatment protocol for anything. I don't really have a good answer. I don't know a good answer, but I think that also I think supplements are always thought of secondary in medicine often. And for me, I supplement as needed. I'm not a supplement person. My practice as a coach is not driven by supplements. I use sparingly.
But if you're deficient, you would obviously show someone with a vitamin D of 20. You'd say, hey, maybe we need to bump that up, get out in the sun, get breath fresh air, and here take 5 to 10,000 IU of vitamin D till we get into a therapeutic range.
100%. And that's supportive of other hormonal stuff too. That's going to support the sex hormones. That's going to support the thyroid. So yeah, it's, again, multifactorial. That's a really important marker. So yeah, I don't know. I don't have a good answer to that.
Well, and it's frustrating for people, those of us that are in kind of the nutritional health space, because we want that information to get out there. And I mean, thank you for correcting me, by the way, on the social distancing and wearing a mask and all that being good protocols. But I guess what I was saying was training people about how they don't need to fear a virus if they make their own immune system strong enough. And they're not talking about anything that would boost the immune system. And so that's kind of been frustrating for a lot of us that are in the debate.
I don't know how much mainstream medicine believes that you can. And
that's a shame.
I mean, I don't, that's just kind of talking off the cuff about it. But when I think about it in this moment, it's not something I've ever thought about before this moment. I don't know that we focus on that so much. There's no prevention in modern medicine anymore. Everyone in society is already sick. That's why shifting so much money to preventative programs 8 or 10 years ago was kind of a misstep. The heart was in the right place. Preventative programs are great, but you already have this problem on the other side that needs to get addressed. So I don't know that we sit around thinking about that in medicine so much. I'm sure some doctors do. For those of us in the hospital, we're handling something that's happening right now in real time. We're not seeing someone on an outpatient basis and trying to keep them in a state of health or get them in a better state of health. So I think it's part of the way the system's broken. I mean, that's why I left acute care. I couldn't reconcile what I know to be a best practice for people's health with what is the current practice. I couldn't reconcile it within myself.
Well, and in acute care, you saw people with the ramifications of their choices in their diet and lifestyle.
Yeah.
And I'm sure that became disheartening. And I'm disheartened now by something you just said regarding, well, they're kind of shifting away from the preventative care model because everybody's sick. And I'm going, no, there's still value be redeemed in those who aren't really sick yet. Yes, it's a large majority of the population that has some level of insulin resistance. I think one study showed 87% have some level of the spectrum of insulin resistance. But I think there's redeemability, at least in getting people to the best possible health that they can be given their circumstances of where they've been.
Yeah.
And that's where it's frustrating. If mainstream medicine sees no value in boosting the immune system and helping people do that, that to me is disheartening, because even
no, I don't
person
think it's no
can
value.
boost their immune system very well. What?
I don't know that it's necessarily that there's no value seen. I don't think it's considered, and I don't know what's worse,
But
really.
why? Exactly. Like,
Yeah.
if they see the value or if it's not considered, both are bad. So
Yeah. I mean, both, yes, both have impacts on people. And again, I don't know that they're shifting away from preventative care. I know a lot of money, especially federal government money like Medicare, Medicaid money, has been shifted towards preventative programs in the last 10 years. But it's being shifted away from acute care programs, or makes it harder for hospitals to get reimbursement for certain types of cases
I can see
because
that.
that money has been shuffled another direction. And the truth is, you already have these folks that are chronically ill, frequent flying into the hospital for their chronic conditions, not sometimes by any fault of their own. They're following our recommendations. They're doing what they're being asked to do, and they're not getting better, and they're frustrated. And that is what broke my heart, actually.
And there's where the problem is. If the recommendations are wrong and people aren't getting better, and in fact become these habitual patients that you have to see again and again, that's the flashpoint of where we need to make change happen. And the problem is nobody's recognizing that flashpoint. You're identifying it here today, but that's where the rubber meets the road. So you pour the money into those for those acute patients now, but then you have to at least start the education process on the back end, right, so you ward off the ones that will be coming a decade from now.
Yeah, get rid of the freaking food pyramid, please. Start there. Please start there.
Yeah, and you get it out from under the USDA. The USDA, as long as they're going to be involved, it will keep pushing grains, and more grains. So I have long pushed that the dietary guidelines, and I actually testified before that committee back in 2010. I was one of two just average Americans. Everybody else was from industry and all kinds of things, reading their script. I get up there and just share from my heart, guys, you're doing it all wrong. I literally did everything the opposite of what you said to do, and I got healthier. And why can't you give people multiple options to choose from? We all have different size shoes. I wear size 13 triple E, maybe you wear 8, and so we need to be customizing it. And I said, I'm going to come back 5 years from now when all these data gets worse and worse, diabetes, heart disease, obesity is all worse, and I'm going to look you in the eye and go, why?
Yeah. The cost, the human cost is heartbreaking. And I could no longer walk into the room of a patient that had just had open heart bypass and give him the dietary guidelines he's supposed to follow to save his life to go home. I never didn't do it. I want to make that clear. I never went against it, but going against my heart stopped being something I was willing to ever do.
That's
and
a lot of you.
It did. It did. It made me hate medicine, which breaks, and until things change, I mean, that's part of why coaching kind of feeds me, is because in that space, I'm not functioning as a nurse, I'm functioning as a health coach, but I have the benefit of that knowledge behind my advice.
Right.
So having that perspective allows me to maybe guide people more in that preventative direction, say, hey, this is going this direction. Let's try to take it more this direction and see what happens. And it kind of tries to heal that wound a little bit, but it is a wound. It breaks my heart. And I had a 23-year-old diabetic woman one time who had been in the hospital for diabetic ketoacidosis probably 3 times in the past year. And I had a little come to Jesus with her one evening, and she said, Jessica, I am doing everything they're telling me to do. I swear, I'm not missing my insulin shots. I'm I'm counting the carbs. I'm doing everything. And I at the time had just finished my Whole30, and I wanted with all my heart to tell her there's another way. And I couldn't. Wow. And I couldn't do that anymore.
Could you get fired? Is that what you were worried about?
No, it's just, that's not, you in medicine, you practice evidence-based practice. It's not the Wild West. You don't get to practice based on what you believe is true or what aligns with your own beliefs. And that is the accepted recommendations for a diabetic person are what she was following. And it's not my place, nor is it proper for me to advise her otherwise.
I'm going to ask you a very tough question, and that is, what's the evidence that that diet works?
There's none. There's none.
So it's not evidence-based, it's protocol-based, based on what you were taught that you were supposed to
It's
do.
bad evidence-based.
So at that point, isn't it incumbent, and I'm just having a hypothetical with a medical professional, this is fun, by the way, of if you know something that has better efficacy than the failed protocol that you've seen fail again and again and again, isn't it your duty as a medical professional to share what that protocol is?
If I were a medical doctor, I feel yes, that would be part of my place. As a nurse, I don't prescribe or diagnose, and it is not really my place to make those recommendations. But my conflict with supporting the recommendations is what led me to step away and no longer make those recommendations because I couldn't reconcile it anymore.
And mad respect to you, by the way, because many would just go through the motions and get the paycheck and not care. But that would have killed you. You would be a shell of the great woman you are now. So you're happier now with what you're doing, although you're seeing another end of the whole spectrum of disease progression, seeing these younger patients now having babies. So I guess that kind of ramifications of our dietary sins still shows up in every aspect of medicine.
It absolutely does. There was no, I mean, I think I probably had my own inherent biases about obstetrics and what I would see. And it's definitely absolutely a combination of emergency medicine, intensive care, a little bit of med surge, and these people aren't well. A lot of them aren't well. Very few people come in healthy, have a baby, and go home. I see so much gestational diabetes. I see so much hypertension or chronic hypertension superimposed over preeclampsia. There's so much of it. And I would venture to say, and I don't have numbers behind this, this is just like a gut feeling. I think I'm seeing more now than I did 5 years ago. Or rather 4 years ago when I switched departments. So that's hard. And the recommendations for pregnant women, you don't experiment on pregnant women. So really valid studies on diet and insulin resistance and all of that on people that are pregnant don't exist. Now, my gut of what should happen is there. I have very strong feelings about how gestational diabetes should be handled and how insulin resistance should be tested early in pregnancy. I have feelings about that, but it's hard to say what to do because there really isn't data. So at this point, you just support them and say, eat healthier.
Yeah, and see, here's the dirty secret. A lot of patients think the low-fat diet is based on really sound, solid data, and it never was either. So in the absence of data, I just think at least letting the patients know, okay, we don't really have a lot of strong evidence for these kinds of things. And you do that in your health coaching. That's why you went to the health coaching route, which I love, which, by the way, as we're ending the show, tell them about your health coaching services. Again, guys, keto_nurse_Jess. Once you're there, she does have a little link tree there you can click on. And I assume there they can sign up for your coaching services.
Yeah. The way I do coaching signups, everyone is entitled to a free consultation. If you sign up on the free consultation on the website today, www.newterrainwellness.com, if you put in the comment section, Jimmy sent me, and you do decide to go ahead with coaching, we're going to do 50% off 3 months of coaching.
Wow.
Yes.
Hey, my name actually got you some money today, guys.
Wait, there's more.
There's more.
I have we didn't talk about sleep at all today, but sleep is such an integral component to your health and wellness overall. And it was a huge part of my own struggle. And I've written a 10-step guide on improving your sleep starting tonight, actionable steps you can take starting today to improve your sleep and improve your health. And that guide is at a discount if you use the code Jimmy20.
Perfect. Give me one.
Give you one what?
One way
tip
tonight
One tip, get the food and drink and alcohol out of your life at least 3 hours before sleep.
I say 4 in my
4?
work. So that's what I do. And so
cut it off at 3 at least.
Lovely, lovely, lovely. Well, guys, again, go check her out, keto_nurse_Jess over on Instagram. And yeah, take advantage of those deals she gave. I didn't know she was going to do that. So that's awesome. But thank you so much for being here today. You are a delightful person to talk to, and I've enjoyed talking to you on the Instagrams. And girl, you don't know how to stop talking sometimes. And I love that. Like when you it, you just exude all of that, and I think people saw that on today's show.
I got a lot to say, and I'm gonna keep saying it.